How is avian aspergillosis diagnosed? Have you ever wondered how veterinarians identify a serious fungal infection in birds? Avian aspergillosis is a significant concern for bird populations, and diagnosing it can be quite challenging. Let's break down the process of diagnosis and how it fits into bird conservation efforts. The journey to diagnosis often starts with observing the bird's clinical signs. Symptoms like respiratory distress, weight loss, and unusual behavior can indicate the presence of this infection. Birds suffering from aspergillosis may show signs of respiratory illness, which can be alarming for any bird owner or conservationist. Next, understanding the bird's history is essential. Knowing if the bird has been in moldy environments can help pinpoint risk factors. This context is vital for veterinarians as they assess the situation. When it comes to diagnostic tests, several methods are utilized. Blood work is one of the first steps. Complete blood counts and biochemistry profiles help evaluate the bird's overall health. These tests can reveal signs of infection, such as an increase in white blood cells, which indicates an immune response. Serology testing is another method used to check for antibodies against the Aspergillus fungus. However, this test can sometimes yield false negative results, especially in birds with weakened immune systems. A more advanced technique is the Polymerase Chain reaction test, which detects Aspergillus DNA. This method is particularly useful for birds that are immunocompromised, as it does not depend on the bird's immune response. Imaging techniques like radiographs, computed tomography scans, or magnetic resonance imaging can also play a role. These tools help identify lesions or granulomas in the lungs or air sacs, which are often associated with aspergillosis. Endoscopy is another valuable procedure. It allows veterinarians to visually inspect the respiratory tract, helping to identify any fungal growths or lesions directly. Finally, cytology and histopathology involve examining cells or tissues for fungal elements. A biopsy may be necessary to confirm the presence of Aspergillus, providing a definitive diagnosis. In the context of bird conservation, diagnosing aspergillosis early is vital. It helps prevent the spread of this disease within bird populations. By using a combination of these diagnostic methods, veterinarians can improve their chances of accurately identifying the infection. Aspergillosis poses a serious threat to birds, especially in environments where mold is prevalent. Understanding the challenges of diagnosis and employing multiple techniques can aid in managing and treating this disease effectively. This is particularly important in conservation efforts, where the health of individual birds directly impacts the well-being of entire populations.